What's up, guys? So today we're going to be looking at the skeletal system. Now, when we talk about physiological systems, the first few things that we're really going to discover about the systems are their functions, their basic units, and then look at the intricate details. So first, let's start with looking at what the functions of the skeletal system are. Now, obviously, we can see that the skeletal system provides our framework for our body. So this serves as muscular attachment sites, which then act as levers and pulleys that move us. So the skeletal system, one, provides the framework, and two, with the support of the muscular system as well as with the nervous system, which we will see, helps to produce movement. Now, obviously we can see that the skeletal frame is pretty dense and sturdy. We do have organs usually encased in different parts of the skeletal system, so it offers protection for those vital organs. So clearly our skull protects our brain, and then our rib cage protects our lung and heart. Now, also the bones of our body will actually store minerals such as calcium and other minerals that will embed themselves inside the bone. But also the long bones, which we'll take a more in-depth look at, will actually store bone marrows. We have two types of bone marrow. We have red bone marrow and yellow bone marrow. Yellow bone marrow helps to store the fats of our body, helps to store fat in our body. And this is why dogs really like to chew on those bones, because there's a lot of fat in the bones. Or this is why we boil bones in a broth, to have a bone broth. It gives that, it releases those fats out of the bones and gives it a flavor. Now, in later stages of life, we lose a high ability to produce red blood cells in large, long bones, but usually in early stages of life, we can. And so the red bone marrow produces the red blood cells in the long bones of our body produce those red blood cells. Now, a key thing to note is the production of red blood cells is what we call hematopoiesis. Hematopoiesis is the production of new red blood cells. So as we look at the bones, we looked at the functions and structure of it. Now let's go ahead and kind of break it down into different parts. So bone tissue. There's two types of bone tissue when we look at the anatomy of a bone. We have hard or compact bone, and then we have spongy bone. So the hard or compact bone is usually the outer shell. It's very dense and very sturdy. And then the spongy bone is usually a projection off of the hard bone that spans into the depths of the bone and into the hollow space. So the hard bone is made up of those osteons. The osteon is the functional unit of the skeletal system. An osteon is essentially cylindrical structures stacked inside of each other. So think of like taking your grandma's Tupperware, and you have one big Tupperware and then a smaller Tupperware placed inside it, and smaller and smaller and smaller and smaller. You have all these little cylinders making what would look to be a birthday cake if you were to cut it out. So the osteon has these cylindrical structures, but it'll also need the ability for blood vessels to pass through it. So it has a few canals in it. So in the osteon, we have canals that run straight up and down. Those straight up and down canals are what we call the haversian canals. So the haversian canals run vertically or straight through the center of each osteon. Then we have the Volkmann canals. The Volkmann canals run across the osteon or transverse. And when it comes to that spongy bone, the spongy bone is made up and given its characteristic appearance, which is a lattice work-like appearance, by what we call the trabeculae of the spongy bone. So it's a little spongy-like appearance. So as we go into the smaller structures of the bone, like we said, tissues, as we learned from our introduction to anatomy, tissues are made up of cells. So we have bone cells. And if we use our prefixes and suffixes and root words, we would use the word osteocyte. Os is a word meaning bone, referring to bone. Osteocyte. So this is and cyte meaning cell. So this is the cell of a bone. Now there's a lot of bone cells that will help to make up the bone itself. Now there's two particular types of bone cells that help with structuring and remodeling the bone. We have what we call osteoblasts and osteoclasts. So the osteoblasts build bone, and then the osteoclasts will break down the bone. So blasts build, clasts cause a catastrophe and break it down. So the osteoblasts will blast out new bone material while the clasts come through and kind of eat it away. And your bones are always constantly remodeling. That over the span of your life, you will have complete new bones every roughly about 10 years. It usually takes at least about 10 years to remodel an entire femur. Now, to get into a little more detail on that bone remodeling, we said that the osteoclasts will come through and they sort of shear away the layers of the bone, and then the blasts come in and pave and build new bone. Now, we call this remodeling, and remodeling occurs based off of many factors, such as age and your gender, hormonal factors. Of course, also, it's based off of activity. So bones will remodel based off of the stresses imposed on them. So if they have high stresses, so for athletes, they might have more denser bones, while couch potatoes might not have as dense of bone. And this is based off of Wolff's Law. Wolff's Law, based off of the piezoelectric effect, states that structures with forces imposed upon them react accordingly and become more resilient to those forces, and bone is no exception to this rule. So clearly, looking at this skeleton here, we can see that bones come in a variety of shapes and sizes, and they have classifications based off of their shape and size. So clearly, some of the easy ones, and one that we will look at in a little more detail, is a long bone. A long bone happens to just be long, and it has a few structures that we'll look at. Then we have flat bones. Flat bones would be similar to our ribs, our scapula, or even the plates of our skull. We then have irregular bones. Irregular bones don't have a necessarily given shape. Irregular bones would be that which we would see in the spine here. Then we have small bones, or short bones as we call them, and those are usually found in the wrist, your tiny little wrist, or bones in the foot. And then lastly, we would have sesamoid bones. Sesamoid bones, such as the patella in the kneecap, grows inside of the tendon of a muscle. Now, looking at the anatomy of a long bone, we can see different parts to it. One, look at the central portion. We know that the central portion is what we call the shaft, but it has a particular name called the diaphyses. The diaphyses is the central shaft of a long bone. And then on top of the two ends of the long bone are the epiphyses. Epi meaning on top of. So the epiphyses are the ends of the bone, the diaphyses is the central portion of the bone. Now, we're not going to look at the growth plates, but we're going to keep it simple here. So looking at the epiphyses, the two ends of the bone, are covered in a particular cartilage that is meant to serve as a cushion for the articulation between two bones. If we remember back to that lecture on the brief intro to anatomy, it's cartilage, it's a hyaline cartilage. Hyaline cartilage is found on the articulating surfaces of bones, and it helps to serve as cushioning and protection against the grinding of bone-on-bone contact. Now, the diaphyses is covered by connective tissue as well. As we remember that the hyaline cartilage was a cartilaginous form of connective tissue, well, the diaphyses is covered by connective tissue as well. It itself is covered by what's called the peri meaning surrounding ostium. So this is the covering of connective tissue that is the covering of the bone. And then the periosteum, as we can remember from the lecture on the intro to anatomy, the periosteum is actually a continuation of that superficial fascia that permeated all throughout the entire musculature down through to the bone. So all the muscles that lie on top of the bone are covered by superficial fascia, which then folds and covers each individual muscle fiber, which goes down to the bone itself. And so we'll see that breakdown breakdown in the muscular system here in the next video. So looking at a little more in-depth view of the diaphyses, we saw that it was covered, yes, by the periosteum, but on the central portion of it, the center of the diaphyses is actually hollow. We call this the medullary cavity. Now pay attention to the word medulla. The medulla we'll see often repeated throughout a lot of lectures. The medulla just means the center. It means on the inside, in the central portion there. So the medullary cavity is the cavity that is in the hollow space in the diaphyses, which stores and houses that red and yellow bone marrow. So we see tons and tons and tons of bones in the skeleton here. Now, in order to kind of group them up together, we have two classifications of bones based off of where they're found. So we could have what we call axillary skeletal bones or appendicular skeletal bones. So axillary bones, just thinking like the axle of a car, the axle is in the center of the wheel. So if this is your wheel, the axle is going to be in the center of the wheel. You wouldn't want to position it anywhere else because then you would have a wheel lopsiding and going down the road. So axial skeleton is the central portion of the skeleton. So if you can just remember and commit to memory what bones are in the axial region or the central region, then it should be easy to remember that every other bone is outside of this. So clearly, anything pretty much attaching to the spinal cord, spinal column, the vertebral column here, is axillary. So the skull, all of the vertebrae, the sacrum, and the coccyx are in the axial region of the skeleton. Then the ribs and the sternum. The sternum and the ribs are part of the axillary skeleton. Then everything else, all the other bones are appendicular. So all the bones of the shoulder girdle, such as the clavicle, the shoulder blade or scapula, the humerus, the radius, the ulna, all of the carpal bones, the metacarpals, and all of the phalangeal bones, then parts of the pelvis, all three parts of the pelvis, the ilium, ischium, and the pubis, the femur, the patella, the tibia, the fibula, the talus, the calcaneus, the navicular, all of the tarsal bones, all of the metatarsals, and then all of the phalangeal bones of the foot are appendicular. So like we said, when you have a 50-50 shot, commit yourself to remembering one over the other. And then by remembering one, without a doubt, you inadvertently have remembered the other. So knowing that in the axillary region of the skeleton, we have the skull, all of the vertebrae, the sacrum, the coccyx, the ribs, and the sternum, then you should, without a doubt, remember all of the other bones in the outer or appendicular region of the skeleton. So it's no surprise to us that bones come together. So when bones come together, we call that an articulation. Bones are articulating around each other, or we call this a joint. A joint is where two bones or more come together and move around each other, and that forms a joint. The only exception to this is that the only bone in the human body that does not articulate with any other bone is the hyoid bone. The hyoid bone, which sits here in the throat, actually is supported by muscles and does not make bone-on-bone contact, does not make contact with any other bone. But every other bone in your body will contact at least one other bone and form a joint. The only exception, like we said, is the hyoid. So when it comes to these joints, we can classify them in several ways. We could have a structural classification and then a functional classification. The structural classification would denote what structures are present in this structure, and then the functional classification would denote what movements or functions does this joint permit. So when it comes to the structural classification, we can have fibrous joints. Then we can have cartilaginous joints. And then lastly, we have synovial joints. So fibrous joints are bound by dense fibrocartilage. And so typically the example of those are the plates of the skulls, which are fused together. Cartilaginous joints, such as in between the bodies of these vertebrae, or even the pubic symphysis of the pelvis, are held together by cartilage, cartilaginous structures. Then lastly, synovial joints, which have all the characteristics and components of a synovial joint, including synovial fluid, and are freely movable, such as the shoulder joint here, obviously offer a lot of free movement. So pretty much there are more synovial joints in their body than any other of the other types and classifications. So let's look at the functional classification. So when it comes to the functional classification, we can have synarthritic joints. Synarthritic means that it does not move. Arthritic is a word that means movement. So synarthritic, you think in this one particular case, sin means something you don't do, you don't want to sin. So synarthritic means you don't move. So synarthritic joints don't move. So synarthritic joints line up with the fibrous joints, such as the plates of the skulls. Then we have amphiarthritic joints. Amphiarthritic, it's like an amphibian. An amphibian is sometimes on water, sometimes on land, and neither both all the time. So amphibians are kind of yes and no, right? They're a little bit of movement, not a lot. They're a little bit of land, a little bit of water, not a lot, right? So amphiarthritic joints allow some, but not a lot of movement. And then the amphiarthritic joints line up with the cartilaginous joints. So while we do have some movement at the intervertebral joints, we don't have a tremendous amount, especially even at the pubic symphysis. Then we have diarthritic joints. Diarthritic joints are freely movable joints and line up exactly with the synovial classification of joints. So synovial joints or diarthritic joints, which is where Dex gets his name, diarthritic Dexter, the diarthritic or synovial joints are the most numerous joints in your body. Pretty much every joint in your body is diarthritic or synovial. It allows some movement. So your shoulder is no exception. Your elbow is no exception. All of the joints in the forearm, all the joints in the hand outside of a few are synovial. Right, so all of these synovial joints, freely movable joints, are characterized by a few things. So let's look at some of the structures that you would find commonly in synovial joints. One being a joint capsule. The entire joint is encapsulated in a structure, a joint capsule. Inside of that joint capsule, we have a synovial membrane. If we remember back from the basics of anatomy, we have connective tissue membranes, one being synovial. We have a synovial tissue membrane, which then produces synovium or synovial fluid. So synovial fluid would also be present in a synovial joint. Synovial fluid is the fluid inside that joint which helps to nourish and provide less friction between the joints as they move. We would also find bursas. Bursas are tiny little sacs that are filled with synovial fluid that act as cushions between bones and tendons and so on and so forth. And then with that said, we would have tendons also running through certain of these structures, or even tendon sheaths, synovial sheaths on tendons. So tendons themselves will have synovial membranes and sheaths that help to provide lubrication as these tendons move. Don't forget that we would also find ligaments inside of the joint as well. So ligaments help support joints because ligaments connect bones to other bones. And that's a huge difference between tendons. So ligaments only connect bone to bone. Tendons connect muscles to bones. So remember that little difference between the two. Then, of course, we would also have that hyaline cartilage we just previously mentioned. The hyaline cartilage is vital in synovial joints to help cushion that bone-on-bone contact. So these joints can also be further classified by how many axes or axi they move on. So we could say that a joint is uniaxillary, biaxillary, or multi or triaxillary. So what do we mean by that? Well, in order to make this movement occur, we would basically take a pin and we would try to pin the bone, pin one bone to another bone, and then allow that movement to occur. So the origination of the bone's movement occurs at the axis. So for instance, if I was going to do flexion of the shoulder joint, flexion or extension, In order to keep that bone in place when I do this movement, I would take a needle or a pin and just pin it straight through the shoulder here, straight through the humerus into the scapula to then make that movement. So my pin would be sticking out much similar like this. So here's my pin. I'm going to take my pin and then stick it straight through to the humerus joint here and then just cause this movement. So this is axillary classification of the joint. So if we had biaxillary, well, so for instance, I pin the shoulder in this manner to cause flexion and extension. Well, if I want to cause adduction and abduction, I would then take a pin and come straight down here. Adduction and abduction would then occur at this pin. Then, if I came at another angle and had a triaxillary joint, that would allow for the horizontal adduction and abduction, then we would have 3 or even more axi to cause movement. So the axillary classification of the joint is where the movement originates at. So the movement is originating right here at the glenohumeral joint, right? So we put that pin there. Now the movement occurs in the plane. So the movement comes through the plane. So we have a planar definition of the joint too, because the joint has to move through the plane of the body. So when we remember the planes of the body, we had the sagittal plane, we had the frontal plane, and then we had the transverse plane. We can see how sagittal plane running straight front and back, taking us into left and right parts, flexion and extension occurs in that sagittal plane. Adduction and abduction would occur in the frontal plane, which is separating us into front and back parts, or anterior and posterior parts. And then we would have transverse adduction and abduction, or even internal and external rotation occurring in the transverse plane cutting us into superior and inferior parts. So I know that's a little confusing, but try to rewind and get that double capped in there for your memory there. Now with the classification with axi and planes of joints, there are 6 types of synovial joints that we find in the body. Obviously, one easy one to identify is the ball and socket joint, our shoulder joint, the most freely movable of those joints, which does all of the conical movements: flexion, extension, adduction, abduction, all of the forms of adduction and abduction, circumduction, rotation, all of those good things. Other types of joints would be like pivot joints. Pivot joints, such as when you're playing basketball, you're rotating on the spot, right? One foot has to stay in place while you pivot around that foot. Then we could have gliding plane joints. Gliding plane joints just slide past or on each other, and so usually only emit certain movements. Then we could have condylar joints. Condylar joints, somewhat similar to the ball and socket joint because they have some of the most movement that we would see in these types of joints, but are formed by 2 condyles usually coming together and articulating with each other. We would also have the saddle joints. Remember, the only saddle joint in our body is here in the thumb. And so it's like a horse saddle, which is this U-shaped structure, and then a rider is going to have another U-shaped structure as they spread their legs, and then they sit on each other, and then they kind of just do that flexion, extension, adduction, and abduction. Then the last type of joint, the last type of synovial joint we see is a hinge joint, which is pretty simple. It's just like the hinge on your door. It just opens and closes. So imagining that Dex here is this hinge on a door, we close the joint and we open the joint. So hinge joints will only allow for flexion and extension. So again, a brief recap of our 6 synovial joints is the ball and socket, gliding plane, pivot, saddle, condylar, and then hinge. So to not eat up too much time in this video, we would want to look at the movements that occur at the joints, but I already have a video on this that also even explains the planes and then all of the movements that can be all of the movements that joints can perform. I'll link that video here in the description below for you guys, so make sure you check that out. Now with that, let's go ahead and look at some relevant pathological conditions to the skeletal system or the skeletal framework. So our first one would be adhesive capsulitis. Adhesive capsulitis is a fancy term for frozen shoulder, Frozen shoulder, right? We can obviously understand what that means. Frozen shoulder is where the shoulder itself becomes immobile or frozen. Now, frozen shoulder can be an overuse injury, it could be an underuse injury, it could be an infection, it could have a lot of onsets. And understanding the onset really brings us into what we would do for the treatment of this condition. So first, if it's an overuse injury, well, we just want to let it rest and relax and just not mess with it. If it's an underuse injury, we want to try to slowly integrate movement and function back to it. If it's an infection or an inflammatory disorder, then we would want to allow that to heal, allow the antibiotics or whatever you might be taking for it to act in place. So massage therapy can be very beneficial in the help of frozen shoulder. Now, generally frozen shoulder is not permanent and usually corrects itself within a few months. So the next condition is a Baker's cyst. A Baker's cyst is an accumulation of synovial fluid behind the kneecap, behind the patella, or in the knee itself. This is usually caused because of damage to other structures in the knee, which then produces inflammation, swelling in the area, and then that accumulation of fluid and pressure behind the kneecap. The next condition is what we call bursitis. So a bursa, as we learned, was that fluid-filled sac that acts as a cushion in a joint. Itis is a word meaning inflammation. So this is inflammation of a bursa which is a synovial-filled fluid sac. Then the next condition we're looking at are dislocations of joints. Now, any joint can become dislocated, which the technical term for dislocation is a luxation. And then, of course, massage therapists would not want to partake in any of the corrective treatments. We would want to be palliative and help manage any pain after the bone has been reset and they are cleared to get massage. Now, the next condition would be a fracture. A fracture is a partial or complete break in the bone, and massage therapy would have very limited benefit for that. We would then see a condition called gout. Gout affects the joint. This joint particular being the big toe, the metatarsal phalangeal joint of the big toe. So the knuckle of the big toe. Now, gout is also known as king's toe. I like to think of it as king's toe because of a king would be sitting in his throne and he would be eating a big turkey leg and drinking a flagon of grog and just ruling over his kingdom, very inactive, very portly, overweight, and consuming a lot. Why that picture? Because king's toe develops in people with high alcohol consumption or high meat diets. So thinking of this king with very limited activity, eating lots of meat and drinking a lot of alcohol is going to develop gout or king's toe. So not much massage therapists can do for that. So just try to be palliative in anything. The next conditions we have relate to the spine. So we could have kyphosis. So knowing that the spine has these curves to the body, well, kyphosis is an exaggerated kyphotic curve. We have a kyphotic curve here in the thoracic region of the skeleton, or in the region where our thorax is. Kyphosis is known as hunchback. So this is that hunched over, arched back kyphosis condition there. The other condition would be lordosis. Lordosis in the lumbar region, we know the lumbar region is our low back. Lordosis is an excessive forward curvature of the lumbar region, which causes our pelvis to tilt forward, so we would look kind of like this. I like to call it the booty pop syndrome because our hips would roll forward and then hike our butts up. Then another condition would be scoliosis. Scoliosis, as we know, if we look at the spine here, is relatively straight up and down when viewing it from the front to the back. Scoliosis is a lateral curvature in the spine. So this curvature to the side will give you that little, weird sideways kind of appearance there. So scoliosis is a lateral curvature in the spine. Then also relating to the joints, we would have osteoarthritis, or OA. Osteoarthritis is just general arthritis, the general wear and tear arthritis, which is the breaking down of the hyaline cartilage in the joint. That hyaline cartilage, as we remember, can't stress that enough, is the cartilage found on the articulating surfaces of the bones, which helps to reduce the friction. So with the osteoarthritis, losing that hyaline cartilage, we have bone-on-bone contact, which creates inflammation and discomfort in the joint itself. Another condition would be osteoporosis. Osteoporosis, os again meaning bone, porosis, I'm thinking of porous, right? So this is loss of bone density in usually the vertebrae of the spine, which then leads to being very brittle and causes them to be suspect to breaking a lot easier. So be very careful with your pressure on someone's back who has osteoporosis. The next condition we'd be looking at is rheumatoid arthritis. Rheumatoid arthritis we believe to be an autoimmune disorder. This rheumatoid arthritis is the body itself recognizing something in itself as foreign. In this case, it's the synovial membranes of the joints. So typically it occurs at the fingers and in the hand, and then can move up and affect and attack any other joint, but most commonly it starts in the extremities and moves its way in. So rheumatoid arthritis can happen in what we call exacerbations, which means it comes and goes sometimes, and is usually very painful when it does. So if a client is in an exacerbation of rheumatoid arthritis, we want to postpone the massage until the exacerbation has subsided. And then otherwise, massage could be very beneficial. There are some studies that it would take a lot of time to get into right now, but massage can be seen as beneficial for rheumatism and rheumatoid arthritis. The next condition we're looking at is spondylosis. Spondylosis is a condition of the spine which basically equates to osteoarthritis of the spine. Spondylosis is more common here in the cervical region of the spine, which is the neck. So this would be arthritis essentially in the joints or the facet joints of the neck. So we'll see this condition again when we look at the structures of the neck and all of the muscles there as well. We then have a sprain. So as we saw, we had ligaments and tendons, so we have sprains. We could also have a strain. The difference in between them is knowing that sprains are injuries to ligaments and strains are injuries to tendons or muscles. Now, there are 3 different grades of sprains and strains, and they all have their own method in which recovery can be implemented, and massage can be beneficial in some of those implementations. So the next and last condition we're looking at is TMJD, temporal mandibular joint disorder, or temporal mandibular joint dysfunction, which, as you might have guessed it, is the jaw joint. So this is the pain around the jaw caused by many different factors, which can be greatly helped by massage therapists depending on its onset, especially for those massage therapists who, in their state laws, are allowed to do intraoral massage. Intraoral massage being able to get inside the mouth and work on the inside muscles of the jaw. So guys, that's going to do it for the lecture on the skeletal system. So please take your notes, review all the videos, rewatch it if you need, and I'll see you guys in the next video. Have a great day.